Urgent care versus the emergency room. The battle lines are drawn. If you had a medical issue right now, would you prefer the emergency room or urgent care?
I hate emergency rooms, so I guess I would probably prefer the urgent care.
Urgent cares offer many of the same treatment options as the ER, but the pricing and wait times do not compare. Rhonda English is always in pain, but hates the ER. Is it too expensive? Too much time?
It's expensive, it's a lot of time, and there's just a whole lot of everything.
The average emergency room wait time is 3 hours. An urgent care walk-in patient is usually seen within 15 to 45 minutes.
If you go to that emergency room, I mean, you can get hit with a $1,500 bill and up, right?
The copay itself, if you have insurance, is a lot more. And then if it's self-pay, then of course it's a lot more.
We came here to Beaumont Hospital's brand new urgent care in Troy, set up much like an ER. Doctors and staff in the center with an eye on every exam room. Dr. Bernice Sessa is an emergency room doctor, but now is the regional medical director for Beaumont's urgent care facilities. 30 more, just like this one, are in the works.
We want to actually cater to all our community. We want to make it convenient for them, but also help our primary care doctors that are unable to see their patients for one reason or another.
Dr. Sessa says an urgent care visit typically runs $75 to $150 with additional costs for shots, x-rays, and labs. It's best for colds, flu, sports injuries, sprains, and if you need to be seen in the evening or on the weekend.
So a lot of people don't think about urgent care for an x-ray. I have pain in my rotator cuff, so I'm gonna get a simple x-ray today, in and out.
Your x-ray is seen immediately by a radiologist, same as in the hospital. In some areas, urgent care centers have MRIs, CAT scans, and in-house laboratories just like in hospitals. A lot of millennials want to be seen on the fly and don't want to wait for an appointment. So Beaumont created Save My Spot. You sign up for the time you want on their website and check in when you get there. Millennials like Heather Usikowski, only 26 and in college, say they like the convenience and cannot afford the ER. And did you get hit with a big bill?
Yeah. Pretty hefty bill. Still paying for it now.
A couple $1,000s for a minor injury or multiple $1,000s if you're going to be admitted.
Still, there are moments when the ER is critical.
A patient came here
That's
and
right.
you ended up sending them to the emergency room. When is that the case?
Well, this case was a patient who came in for abdominal pain. So what we did is evaluate the patient, make sure that they are stable.
The ER is also critical for things like major trauma, loss of consciousness, heart attack or chest pain, and uncontrollable bleeding. And while the cost is higher, it could mean life or death, and there is no battle to be won over that.